Namaste and welcome back to Ananya Child Development Center podcast. I'm Madhavi and today we are tackling a topic that fills every parent's heart with worry: fever in children. We're incredibly fortunate to have with us Dr. Srinivas Jakka, one of Hyderabad's most respected pediatric pulmonologists, who brings not just his extensive experience from the UK's renowned Alder Children's Hospital, but also his deep understanding of Indian families and their concerns. Dr. Jakka, welcome to Ananya podcast.
Thank you, Ms. Madhavi. I'm happy to be back at Ananya once again to share my experience regarding the common childhood problems. And today we can discuss about one of the commonest problem in children, which is fever.
That's exactly why we wanted you here today, Doctor. At our Ananya centers, we often hear parents say things like, "My child had fever last night, should I skip therapy?" Or "How high is too high?" Before we dive deep, Dr. Jakka, could you help our parents understand what fever actually is?
Yes, it's very important for parents to understand what is fever. Otherwise, they'll panic every time the child has fever. Fever itself is not a disease. That's very important to know. Uh, our normal body temperature is usually maintained between 98 to 99 degrees Fahrenheit. Whenever there is any infection or illness in your body, our immune system releases some chemicals, and because of chemicals, our body temperature becomes high. So, a rough estimate would be any oral temperature more than 100 or axillary temperature more than 99 is considered a fever. But rather than worry about fever, it's parents and doctors should be looking at the cause of fever and and then worry whether there is any worrying cause of fever or not.
Okay, that's fascinating. But Dr. Jakka, I notice many parents touching their child's forehead and saying, "Lag raha hai ki bukhar hai." Feels like there's high fever. Is that reliable?
Most of the experienced parents can tell whether the child has fever or not, but just relying on touch is not always advisable because there are multiple factors. For example, it depends on your temperature of your own palm. So if the temperature of a palm is cold, you might overestimate the fever in your child and vice versa. So it's always important to objectively measure the temperature using a thermometer. And that will always be a best estimate of the fever in your children. Because the accurate measurement of fever is important because many times as doctors we rely on the severity of fever to decide about further investigations or treatment. For example, if a child has a mild fever, say temperature less than 100, we wouldn't be worried. On the other hand, if the child has a high grade fever, then we would be more keen to investigate and treat that child.
Speaking of patterns, what are common causes of fever in children? Our parents in Ananya often worry that every fever means something serious.
Yes. So, if you look at fever, there are mainly two types. One is acute fever, where the fever lasts less than a week or so, and then chronic fever, which lasts for a long time. If you look at acute fever, invariably, most of the times it is due to infections. Okay, these infections are due to bugs which come into your body. And these infections are usually caused by viruses and less commonly by bacteria. And these organisms affect different parts of your body. They can affect your respiratory system, they can affect your digestive system, and as well as other parts of your body as well.
Okay. So, could you explain further what behaviors should parents look out for?
Firstly, parents should look out for the symptoms of fever. Okay, and they should also look for warning signs. Okay, the symptoms of fever could be non-specific or specific symptoms. If you're looking at non-specific fever symptoms, these symptoms can be there with any infection. For example, any fever can cause headache, vomitings, body pain, chills, etc. On the other hand, if you're looking at specific symptoms, these depend on the organ systems of the body involved. For example, if you look at the respiratory system, there may be cold, cough, hoarseness of voice, sore throat, earache, breathlessness, etc. If the infection involves your digestive system, there might be stomach pain, vomitings, loose stools, etc. Infection of your ear causes ear pain and ear discharge. Similarly, infections of your brain can cause headache, photophobia, where your child may not be able to look at light, irritability, lethargy, seizures, etc. If the kidneys or urinary tract is affected, there may be vomitings, there may be pain or discomfort when passing urine, there may be altered color of urine, the urine may be smelly, etc. So parents should be looking for the specific symptoms that could help us know which organ or system is involved, as well as non-specific symptoms. And they should also look for some warning signs in children.
Let's address something many parents ask us. Can fever cause brain damage? I hear this concern so often at our centers.
Most of the time, fever doesn't cause any long-term or short-term damage. However, the exceptions are if you have very high temperature, say you're looking at 107 or so, or if the child has any prolonged seizures, then there is a possible risk of damage to the child. Most of the time, we should also understand the severity of fever. We already discussed that any temperature above 100 is fever. 99 to 100, you could say it's low grade fever. 100 to 102 is a moderate temperature. Above 102, 103, you can say high grade fever. Even high grade fever will not cause any damage. We are looking at extremely high fever of 107, 106, like that. There is a potential for causing damage to the brain. Similarly, fever can cause seizures in children called febrile seizures. Brief febrile seizures lasting few minutes will not cause any damage to the brain. Only when the seizures are prolonged, lasting half an hour, 1 hour, or etc., have a potential for causing damage to the brain. So parents should not panic just because your child has fever. In fact, actually, fever is a defensive mechanism where your body is trying to fight the bugs. This is a symptom that comes out as a defensive mechanism, and it may not always be a bad thing.
So, doctor, I think when parents are worried, they're more worried about their child getting seizures in high fever because they must have heard from someone that their child got high fever and seizures. So, they must be scared of that.
Yes, that's absolutely true. Children with underlying neurological problems or epilepsy, in particular, they are at more risk of having seizures during fever than other children. But again, parents do not need to worry too much. They can always have rescue medication to keep with them. So, just in case the child has seizures more than 4 to 5 minutes, they can give this medicine to the children, and this medicine will abort the seizure.
Yeah, I do remember some parents actually giving us a medication here and tell us how exactly they trained us how to use it when if there is an episode of a seizure like that, like you said. So, but why do some children get seizures during when they have fevers, and this can really scare the parents.
Yes, seizure is nothing but excessive activity from the brain. Okay, so your brain releases impulses every day. When whether we are talking, walking, or doing any activity, this is because of electrical signals from the brain. So when the signals are excessive, that causes seizures. So what happens during fever is the threshold for seizures is reduced. So when this threshold is reduced, some children tend to have seizures, and these are called febrile seizures. In other words, seizures that occur with fever. Many times there is a history of febrile seizures in the family member, either the parents or siblings, etc. So this is a condition that can run in families. But as I mentioned earlier, brief seizures will not cause any short-term or long-term damage to the brain. So parents need to remember that. They should also train themselves what to do in case the child has a seizure. This involves giving medicine to abort the seizure, keeping your child in a safe place and a safe posture. And if they wish, they can learn about basic resuscitation also. Learning these things will empower the parents and make them more confident in facing a seizure should that occur in their child.
I think that really helps parents not panic unnecessarily for, worrying that their child is going to get seizures. So, can we now talk about practical management at home? What can parents do at home when their child has fever?
So basically, there are a few things which parents have to do. First thing, as we already discussed, confirm the temperature using a thermometer, not just by touching the child's forehead or body. And once you confirm that your child has fever, Please do not panic. The second thing is to give some medicine to reduce the fever. These are called antipyretics, and the commonly used medicine is paracetamol. This can be given either in the form of a syrup or tablet, and some instances as a suppository put from the bottom. This can help reduce your child's fever. If the fever is very high grade, you can use medicines like Brufen that can reduce higher temperatures. In the past, we used to use medicine called mefenamic acid, which we don't recommend that much to the patients now because it can cause some side effects as well. So then comes the supportive measures. Using loose clothing, try not to cover your child too much because that will what will prevent dissipation of temperature. Make sure the room is well ventilated. Make sure your child has plenty of liquids. And if the temperature is not being controlled by medication, you can use sponging with water to reduce the temperature. But here, always remember that you have to use lukewarm water and not cold water to do sponging of the child, because using very cold water will be counterproductive. Okay, so the three things are: first, confirm temperature, use medicines to reduce the temperature, and third, supportive measures at home. So, using these three measures, parents can control many cases of temperature at home without needing to go to the doctor.
That's really helpful, doctor. What about feeding during fever? Many parents at our centers worry when their child doesn't eat during fever.
Yes, it's a very common thing for children not to eat during fever. In fact, if you remember when we were kids, we were hardly given any food during fever, and we used to wait for the temperature to come down to have some liquids. But these days, parents want children to feed like normal even during fevers. They expect probably too much from the children. Uh, Children do not feed during fever for a couple of reasons. One is due to the chemicals released during the interaction of the immune system with the bugs. There are certain other chemicals released which cause nausea or a vomiting sensation. That could be one thing. And the appetite also comes during fever, which is a natural response of the body. So parents should not panic. They should not expect their child to feed like normal. Rather, they should make sure that the child is having small and frequent sips of liquids. This can include ORS, electrol, coconut water, sago water, milk, buttermilk, juices, etc. Give them small sips like 10 ml, 15 ml frequently. Make sure that the child is having 40 to 50 ml of fluid per day, per hour, sorry. And also, the best way to make sure that the child is getting enough liquids is to watch the urine output. If your child is not taking solids for 2 or 3 days, don't worry. As long as your child is having liquids, reasonable amount, and as long as your child is passing urine 4 to 5 times a day, parents need not worry. At the same time, they should look for signs of dehydration, which can include your child becoming drowsy, lethargic, decreased urine output, etc.
That's really helpful, doctor. When should actually parents think about antibiotics? I notice many parents asking for antibiotics as soon as the fever starts.
Yes, unfortunately, antibiotics are the most abused drugs in our country. As we discussed earlier, many of the acute fevers are caused by viruses, and a small proportion are caused by bacteria. We should remember that antibiotics are antibacterial, so they have no action at all on viruses. In other words, they are not useful in a significant number of fevers. So, antibiotics should be used only when there is a diagnosis of bacterial infection by a doctor. Say, for example, if your doctor thinks that your child has bacterial tonsillitis, bacterial pneumonia, or bacterial urinary tract infection, then antibiotics should be used. Antibiotics should not be used like fever medicine. Similarly, many times parents seek advice from their friend, a doctor friend or relative on the phone, or they may go to pharmacy, or they may use antibiotics themselves, which is actually absolutely not recommended. I am telling this again and again because one of the major problems faced in our country with regard to child care is antibiotic resistance. These days, we are struggling to treat even simple pneumonias and urinary tract infections with first and second line antibiotics because children are developing a multiple antibiotic resistance, or the bugs are becoming resistant to multiple antibiotics. So, if you are a parent and you want to ensure long term health of your child, please do not use antibiotics randomly. This is one advice I would repeat again and again.
So, doctor, What are the warning signs that parents need to look for? And exactly that's when they need to take the child to a doctor. So, how do they identify that?
Yes. So, what I usually suggest to my parents is that you don't need to see a doctor in the first 3 days of fever, as long as the fever is low grade fever and the child is otherwise well. On the other hand, if your child has warning signs like high grade fevers, temperatures 103, 104, which are not being able to be controlled at home, your child has stopped taking even liquids and the urine output has come down, your child has become lethargic, drowsy, or irritable, child is having breathing difficulty, child is having seizures, child is on the bed all the time. So these are the warning signs. Usually most of the time you see that the children are dull when they have fever, but once the fever comes down they are active and playing. So that's a reassuring sign that it's not a very serious cause of fever. However, if the child is dull and lying on the bed all the time, that's again a warning sign. So, if these warning signs are seen, then you should take your child to a doctor. So, your doctor then takes a detailed history of the cause symptoms associated with fever. This is most important. Many times, parents feel that investigations are the most important things to diagnose fever, but that's not true. The most important thing to diagnose fever is the history. So when you go to your doctor, you should tell the symptoms in a chronological order, which means which symptom came first, which symptom came next, so on and so forth. Based on the history, your doctor should be able to choose appropriate investigations. Many times we see parents come with blanket investigations, your fever panels, and again, these things are not going to be helpful. The investigation should be tailor made for the child, and based on the history, examination findings, and the investigations, your doctor will then be able to make a diagnosis of the cause of fever and then be able to treat it.
So, before we wrap up, could you share your top three tips for parents about managing fever?
Okay, first thing, fever is very common in children. You're not alone. Frequent fevers are very common in the first few years of life. Fever itself is not a disease, it's a symptom of disease. We need to understand what is the cause of fever and treat that rather than run behind the temperature and numbers. As a parent, you can do many things at home, as we discussed, to make your child comfortable and reduce the fever. And watch out for the warning signs, and if they occur, please visit your doctor.
Thank you so much. That's really helpful. Srinivas Garu, let's talk about something every parent deals with, coughs and colds.
Okay.
How many colds per year is actually normal for a child below 6 years?
It's difficult to exactly put a number, but there are several studies that show that children during early childhood they can have 6 to 8 episodes a year. So that is normal actually.
Okay, so 6 to 8 times is absolutely
Yes,
normal.
yes. Especially in the early childhood when they just start their child care, whether it's a nursery or daycare or school.
Okay. So when parents come to Ananya, they often ask us about the color of the mucus is green or yellow. Does the color actually indicate how serious the problem is?
Yes, in a way it does. So if you're looking at the cold secretions due to the cold, initially they're clear, then the secretions become thick either by themselves or after using the cold and cough syrups, and sometimes they become really green. So when they become really dark green, that's when we need to worry whether there's a bacterial infection superimposed on the viral infections. Similarly, when they cough out, of course, many children, young children, they do not cough out the mucus. Of their older children, if they're coughing out any secretions or sputum, if it is clear, again, usually we don't worry. But if it is becoming greenish, then we suspect whether there could be a bacterial infection brewing inside.
So, yeah, I know. I've also noticed that very young children don't usually cough that hard that the mucus comes out. They usually vomit. I've seen them cry, and then when they cry, they vomit, and then all the mucus actually they comes out,
Or they just swallow the mucus.
or they
Swallow.
swallow the
Yeah.
mucus.
Yeah.
True. What about those nighttime coughs that keep the whole family awake? Any specific tips for managing those?
If you look at nighttime coughs, there are three main causes. Okay, the first cause is postnasal drip. So what happens is when children have cold, when you're standing, the secretions drip down your nose. But what happens when you're lying down? It drips to the back of your throat, and that causes irritating cough. So this is postnasal drip. So in this case, giving some steam and clearing your nose, and some cough syrups, if the cough is very irritating, can help. The second cause of nighttime cough is asthma. So, in postnasal drip, the cough starts immediately once you lie down, whereas in asthma, it starts half to 1 hour after going to sleep and in the early morning. And again, this causes severe spasmodic cough or a loud cough. And in this case, they should be using medication for asthma. The third cause of nighttime cough is reflux. Your food regurgitates sometimes very high until your throat, and that also can cause cough. And for this, avoiding overfeeding at nighttime and ensuring that there are at least 3 to 4 hours between dinner and sleep. So the tips would depend on the cause of nighttime cough. So if your nighttime cough is brief, lasting few days, you don't need to worry. However, if it's lasting for several days, then please see your pediatrician who will help you in this regard.
That's so important. Nowadays, parents feed children just before they go to bed. And then, yeah, this can cause all kinds of problems again. Many parents use various home remedies like honey, tulsi, or ginger. Which ones of these actually help kids?
I mean, again, parents they can use trial and error method, and to see. I don't mind them using anything as long as it doesn't harm the health of the child, and it's not too pungent or it causes vomiting and other symptoms. I personally found that using honey and warm water will be soothing. What it does, it soothes the back of your throat and reduces the irritant cough. And there are studies also which show that honey and warm water is as effective as cough syrups. With regard to other medicines, parents can try on their child and see what helps them.
Yeah. I'm sure every Indian family has their own home remedy or a concoction that their grandparents make for. I remember the moment we used to have cough, my grandmother used to make something with pepper and ginger and dry ginger, sonti, it's called. She used to make some concoction. We were all supposed to sip it, things like that. That was the first line of treatment at home.
Yes.
If nothing works, then only we would go to a doctor,
Yes, I think that has because one of the reasons is because cough disturbs the family more than the child. Okay,
Yes.
and in these days when both parents are working, it's very difficult for them to have a coughing child day after day, and the child doesn't sleep. The parents can't get sleep. Their work is affected. So I can sympathize with the modern day parents because at the same time, we should not be using drugs overdose also, just for keeping everyone asleep in the family.
Absolutely. There's a big concern that we hear about coughs lasting for weeks after a cold. When should parents worry about a lingering cough?
Here there are three scenarios. One, when you're looking at a chronic cough, which is lasting several weeks, we need to look at the trend of the cough. Is the cough increasing since the beginning or is it in a downward trend? If the cough is showing a significant downward trend and getting better 90% of the, compared to the start, we don't need to worry. On the other hand, if the cough severity is increasing or pretty much the same, like a plateau, then we need to think about what are the causes. So then comes the question, is it a wet cough or a dry cough? If it's a wet cough, it means that there's a lingering infection. Then you need to see a doctor who might prescribe antibiotics. If it's a dry cough, then it could be a sign of asthma. Again, you need to see your doctor who will treat you for that. On the other hand, if there is a prolonged cough with fever, we need to think about chronic infections like TB, where your child need to be investigated and treated appropriately. So when you're looking at long time cough, you need to see whether it's increasing or decreasing. How is it since it starts from the beginning? Is it wet or dry cough? Is there any fever? Is there any breathlessness? Is there any weight loss? So, depending on all of this, we can decide what are the possible causes and do appropriate investigations and treatment.
One more thing, even though we are talking about coughs and colds, one more thing, recently I've observed one parent especially telling me that the child had rash, like small little rash on her body, all over her body. So is rash a common thing in high fevers?
Yes, rash can accompany many fevers, particularly if you look at viral fevers, whether it is measles or your chicken pox, hand, foot, and mouth disease, or any many viruses, they cause rashes. When you look at the rash, you can say this virus is the cause of rash. They are diagnostic of an infection. For example, if you see a rash, you can say on the body with vesicles or water-filled blisters, then you say it's chickenpox. Similarly, if the rash is confined to the palms, soles, and mouth, it's due to hand, foot, and mouth disease. However, some rashes may not be diagnostic of a disease. You call them non-specific rashes. So, answering your question, rashes are very common with viral infections and a few bacterial infections. Again, the distribution of the rash on the body, the evolution of the rash, and other symptoms will tell us at the possible cause of rash.
Okay. So anyway, if they are going to a doctor and there's a doctor who's taking care of the treatment, I think they will be able to handle this. And
Sure.
it is very common.
Yes. So here very important that parents should take pictures of the rash whenever they see the rash in the children, because by the time they go to the doctor, rash may evolve and it may not be diagnostic.
So they can actually show them how it started and how it is after 3 days or whatever, whenever they go to the doctor.
Absolutely. These days, everyone has smartphones and we take pictures. But when I see parents, I ask them to have taken any pictures. Many times I'm surprised to say they haven't taken pictures of this rashes. So, any abnormal behavior, take a video of your child. A picture speaks at more than 1,000 words, that is saying. So, always use your audiovisual aids to record these symptoms.
Nowadays, it's very, very easy to do that.
Absolutely.
So, could you also explain when a cough might indicate asthma? What signs should parents watch for?
Okay. So, when you look at a cough due to asthma, it is typically the cough has a diurnal variation. In other words, it is worse in the evenings, nighttime, and early morning. It is triggered by specific triggers like your running or exercise, emotions like laughter or cry, exposure to cold air, taking some cold food and drinks, exposure to dust, etc. So, when your cough is due to particular triggers and when it's relieved by asthma medications like salbutamol, then you suspect that it could be an asthma cough. In asthma, there may be other associations also in addition to cough, like there may be breathlessness or chest tightness, there may be wheezing. Wheeze is like a fine whistling sound which your child makes. So, if child has cough, breathlessness, and wheeze, nighttime cough due to particular triggers, and relieved by asthma medication, then the cough is most likely due to asthma.
I learned a lot, I think, today about all these fevers and coughs. What about seasonal allergies versus colds? How can parents tell the difference?
Okay, so one of the important differentiating factors is that cold due to infection has associated fever. So if you have a child has a runny nose with a fever, it's not allergy, it's a infection. So many times my parents come, my child ate this thing, he developed fever and a cold. I think it's because of allergy to that food, but it's not so. If the child has cold and fever, it is an infection. On the other hand, your child has cold symptoms without fever, then we need to think about, is it due to allergies? So if you look at cold, there are 4 or 5 symptoms due to cold. Child can have runny nose, blocked nose, mouth breathing, snoring. This can happen with either infections or allergies. However, if your child has sneezing, itchy nose, itchy eyes, red eyes, watering, these can suggest allergies. So, runny nose, blocked nose can be due to infections or allergies, but if a child has sneezing and itching and no fever, it would go more towards allergies. So, based on the symptoms, we can tell whether it could potentially be infection or allergy, and using allergy tests, we can confirm the diagnosis.
So there are particular tests that doctors can advise, and once the reports come, they can tell if it's an allergy or not.
Absolutely. If we doctors suspect that your colds and coughs are due to allergy, we can do allergy testing. It can be done to a skin prick test or blood test, which we decide depending on the age of the child and other factors. Based on that, we can confirm the diagnosis of allergy.
Okay, that's really helpful. What about steam inhalation? It's very popular in our homes. What's your take on that?
Steam inhalation, I don't mind parents giving steam inhalation as long as they take the necessary precautions. I see many children coming with burns due to this hot water. So you have children, parents giving steam inhalation, but suddenly the mother goes somewhere, the child pulls that kettle, and this causes severe burns to the child. So this is most important when you're giving steam inhalation from a kettle and things like that. Be very cautious. Of course, these days we have electric machines that can generate the steam, which are more safer. And make sure that the ambient temperature from the steam is not very hot. So as long as it is not too hot and safe for the child, you can use steam inhalation.
Some parents also nowadays have nebulizers at home. So, why are nebulizers used?
So nebulizer is nothing but a machine that delivers liquid in an aerosol form. Nebulizers are, I would say, misused or overused commodity by doctors and patients in our country. So nebulizers should ideally be used if your child has wheezing due to asthma or any other condition. So if a child has wheezing due to asthma or any condition, then the medicines which we used to give as syrup form in the past, now they are available in nebulizers form. Okay, because nebulizers, one, they are lesser dose and they are more safer than syrups. However, the inhalers are even safer than nebulizers if you want to give these medicines, because inhalers have smallest dose and least side effects. You can give them in 1 minute. You can give it at night time without waking the child. You can carry them very easily and you don't need a power supply. So nebulizers should be used on prescription of a doctor if your condition needs that.
So, thank you so much, Dr. Jakka. This has been incredibly informative. You know, sitting here at our Ananya Center, I'm reminded of something beautiful. How every parent shares the same deep love and concern for their child. Today's conversation with Dr. Jakka hasn't just given us medical knowledge, it's given us confidence. Confidence to know when to worry, when to wait, when to act, and when to observe. To every parent who's ever stood beside a coughing child at midnight or worried about a fever that won't break, you are not alone. Our Ananya family understands your journey. We see your dedication, your sleepless nights, your endless love. Keep today's insights close to your heart, share them with other parents, and remember sometimes the most powerful medicine is a parent's informed care. Until next week, this is Madhavi reminding you that every challenge makes us stronger parents. Thank you, Dr. Jakka, for illuminating our path with your wisdom.
Thank you very much.